breech. Is it clear? Where the child presents with the head, there's a head and a limb, any limb, that's a mixed breech. So those are the different elements. And now inside cephalic breech, we can now have inside cephalic presentation, you can have the frontal, the brow presentation, we have the mentum presentation, we have the vertex presentation. Is it clear? Under cephalic presentation, we have the brow presentation, the mentum presentation, we have the vertex. Among all these, the vertex is the best one. Is it clear? So, and you are going to have the position later on. Is it clear? So those are the different presentation that you can feel. Is it clear? With your fingers. Now the next one, you have the lie. Is it clear? Of the child. So what is, I've not even defined what is called the presentation. The presentation is just the fetal part which is closest to the maternal pelvis. That is what is the definition of presentation. Is it clear? Presentation is the fetal part closest to the maternal pelvis. The fetal part closest to the maternal pelvis. Is it clear? That's the presentation, and we have already discussed on the different types of presentation. Types of presentation are cephalic. Under cephalic, we can have the brow, the mentum, and then the vertex presentation. We have the breech presentation. Under breech, we can have the frank, the complete, the incomplete breech. We have the standing presentation. Is it clear? We have the standing presentation where both limbs are down, and we have also the mixed presentation where you have a presenting part and then you have one limb which is going to be at that level. So you have the presenting part and one limb. So those are the different types of presentation that we have. Now we go to the lie. The lie is the orientation of the fetal spine. The orientation of the fetal spine as compared to the maternal spine. That orientation of the fetal spine as compared to the maternal spine is a lie. And how do you evaluate for lie on the physical examination? Do the Leopold's maneuver. Is it clear? The Leopold's maneuver is made up of four major parts. The first part is to do the fundal grip. So in fundal grip, you place your fingers here. Is it clear? So you place your fingers here on doing the fundal grip. So you place your finger and then you press at this level at the fundus. Is it clear? You press at the fundus. That's the fundal grip. Is it clear? So when you press at the fundus here, you are going to feel a part. Let's say that the child is so let's say that these are the fingers of the child and this is the breech and these are the legs of the child. Is it clear? So this is how here you're going to feel something that is going to be very soft. Is it clear? When you feel something that is soft here, it means that this is at the fundus you have the breech. The breech is the buttocks. Is it clear? Or at the fundus you have the podal. The podal is still the buttocks. Or you can still say that at the fundus you have the buttocks. Is it clear? So that is for the fundal grip. Now the next grip, so that's the first fundal grip. The next is the lateral or the umbilical grip. Is it clear? Lateral or the umbilical grip. For the lateral grip or the umbilical grip, what you do is that one hand is going to press to maintain. So here you press at the level. Is it clear? So one hand is going to press at the level of the fundal, and then the other hand now is going to palpate. Is it clear? So now this other hand here palpate. You palpate to feel for the fetal part. Is it clear? So here you press to maintain the lateral side of the uterus, and here you palpate. Is it clear? So if you palpate and then you feel the limbs of the child, is it clear? You palpate, you feel the limbs of the child. This is the head. You can feel the limbs of this child on this side, and the other way you do that vice versa. Then later on you press here and then you palpate here. You can palpate something that is hard and smooth. That is going to be the back. Is it clear? So that's the next thing that you do in the lateral grip. Immediately after doing the lateral grip, you can now directly evaluate for the fetal heart tone. Is it clear? And the fetal heart tone, you measure it as from the back, as I'm going to explain when you want to visualize the fetal well-being. Is it clear? Now the third element is now going to be measuring to do the first pelvic grip. Is it clear? The first pelvic grip. Now that's the interior loophole maneuver, the first pelvic grip. For the first pelvic grip, you now this is still the uterus. You turn to look the feet of the patient. The obstetrician turn to look the feet of the patient, and now he's going to place his finger as such. Is it clear? So he's going to place his finger as such like this. So he places his finger as such like this. So the obstetrician is going to turn to look at the feet of the patient and place his finger as such. So your head is going to be up here. Is it clear? And then you place your finger as such. You look at the feet of the patient. Is it clear? And this is just to evaluate for flexion. So sorry, this is the second pelvic grip. Is it clear? This is the second pelvic grip. Is it clear? So before doing the second pelvic grip to evaluate for flexion, you first do the first pelvic grip. The first pelvic grip. Is it clear? The first pelvic grip is called the Paulic grip. Is it clear? It's called the Paulic grip or the Paulic maneuver. So in the Paulic maneuver,